Triple-negative breast cancer, or TNBC for short, accounts for 10 to 20% of all diagnosed breast cancers and is one of the most aggressive forms whereby 30% of patients experience relapse within 1 to 3 years. TNBC is categorized by the lack of expression of estrogen receptors, proestrogen receptors, and HER2. Moreover, due to the lack of these three receptors, common targets for hormone-based therapy and drugs become ineffective, which limits treatment for TNBC to chemotherapy. The underlying reason for TNBC's invasiveness is linked to the chemokine CXCL12 and its receptors CXCR4 and CXCR7. Overexpression of CXCR4 increases the risk for unregulated migration and proliferation, whereas CXCR7 overexpression enhances primary tumor growth and angiogenesis. Therefore, Yang and colleagues explored the use of CRISPR-Cas9 genome editing as a strategy for TNBC treatment and discovered that the knockout of CXCR4 and CXCR7 had promising anti-cancer effects. The results of gene knockout on proliferation were examined using colony formation assays. Compared to the negative control, there was a significant reduction in proliferation abilities in all treatment groups, where the CXCR4 knockout showed a decrease in proliferation by 56%, and the CXCR7 knockout indicated a decrease by 54%. However, from these results, the most notable reduction was in the co-knockout cell line, where cell replication dropped by 72%. In terms of studying cell cycle disruption, Yang and colleagues used flow cytometry analysis. Compared to the negative control, the number of cells in G0, G1 phase was reduced by 32% for CXCR4 knockout cells and by 26% for the CXCR7 knockout cells. Most importantly, the co-knockout of both these receptors resulted in a 50% decrease for cells in the G0, G1 phase. Thus, CXCR4 and CXCR7 knockout could delay G1S cycle conversion and promote cells in the S and G2M phases, delaying cell cycle progression and helping to prevent cell proliferation. Before we continue, let's briefly discuss how a Transwell migration assay works. In a Transwell assay, there are two medium-filled compartments separated by a microporous membrane. To induce migration, attractants are added to the chamber's lower compartment, while chemokinesis inducers are added in equal concentrations to both sides of the membrane. Cells are then placed in the upper compartment and can migrate through the pores. After incubation, which takes about 3 to 18 hours, the microporous membrane is fixed and stained so migrated cells can then be counted. Lastly, using a Transwell assay, the effects of TNBC migration and invasion were studied. In terms of migration, cell co-knockout lines led to the most significant reduction of 90% compared to the single gene knockout events, with a 70% reduction of CXCR4 and a 62% reduction of the CXCR7 knockout. Furthermore, when CXCL12 was added, the knockout of CXCR4 and/or CXCR7 resulted in a significant reduction of cell migration capacity when compared to the negative control. Wound healing experiments indicated similar inhibitory effects on migration. To study the effects of cell invasion ability, mitoglobin, a gelatinous protein mixture that resembled the extracellular environment, was added to the Transwell assay. In the absence of CXCL12, co-knockout cells were the most efficient treatment and reduced invasion ability by 90% compared to the CXCR4 knockout that showed inhibition by 68% and 60% for the CXCR7 knockout. Moreover, even when CXCL12 was added to the apparatus, results showed that gene knockouts were effective for inhibiting cell invasion ability. Overall, the knockout of CXCR4 and/or CXCR7 using CRISPR-Cas9 genome technology led to a significant reduction in proliferation and growth in TNBC cells. Moreover, the migration and invasion capacity of CXCL12 added cells were significantly reduced in comparison with the control, and in all cases, the co-knockout treatment rather than the individual gene knockout of CXCR4 or CXCR7 was the most effective means for inhibition. Therefore, it is probable that CXCR4 and CXCR7 have a synergistic effect on cancer progression and interfere with the binding capacity and functions of CXCL12. Altogether, CRISPR-Cas9 was successful in inhibiting the malignant progression of TNBC cells and has the potential to become a useful targeted therapy for TNBC in the future.